Looking at the future of recovery, another phenomenon that we're experiencing now, it's underground and it's on the horizon, at least in the United States, is using plant medicine to treat addiction. So there's some great studies with nicotine and psilocybin, which is the psychoactive component in magic mushrooms. They're also using psilocybin to treat depression, which often is an underlying condition of addiction. There's also been a lot of fanfare about ayahuasca, which is a powerful psychedelic from South America that was used traditionally for either hundreds or thousands of years. And the thought behind plant medicine is to invoke a spiritual experience and to disrupt the default network of the brain, meaning the patterns of our thinking and feeling, in such a way that people can get a boost in breaking free from addiction. Something gets sort of rewired, in shorthand. And plant medicine is becoming popular in the underground. And so if you go online, you'll find it kind of buried there amongst different ways to deal with addiction. I've come across now a lot of clients, successfully and unsuccessfully, who have either tried or used plant medicine to treat addiction. It's a fascinating area. My own general philosophy, well, if I'm speaking to a parent or a potential client who's looking for recovery and looking for help, is I don't have a philosophy. It's whatever works. The way that I think the future of addiction is going to break down is there's going to be a multiplicity of approaches. And in the end, I think the best parallel when looking at the future of addiction is looking at how human beings approach diet. And so there have been all of these different diet fads, that come and go, that huge swaths of our society engage. Everybody's on keto now, or whatever that is. Where I think it's going to go, as modern science is getting there, is the question of what specific diet is right for you. So I think we'll break away a little bit over time from an abstinence-based model, meaning you can't use any substances, to understanding your body and your neurochemistry better, and specifically, what substances and foods does your body and self react well to, and what substances and foods does it not react well to? So I think about it on a spectrum, right? Pretty much everybody knows that processed sugars and saturated fats really aren't good for anybody hardly ever, right? I'm sure there are exceptions, but in general, you want to stay away from that stuff. On the other side, broccoli, celery, these things we really don't like, are pretty much healthy for everybody unless you have some kind of allergy or something like that. So we have the stuff that's pretty much healthy for everybody and pretty much bad for everybody. And then there's a spectrum in the middle that has to do with your own body. Maybe for some people, red meat and the iron in red meat is good. Maybe for some people it's not, right? And you're trying to figure that out. I think what will happen with drugs eventually is the same kind of approach. I call it kind of the right relationship model, which is pretty much for everybody. Crack cocaine, methamphetamine, heroin is not good for your life. And I think we can all pretty much agree on that. But there are a group of substances over here in the proper set and setting that can be good for huge groups of people. And the way that I think about that is there are certain substances that narrow our consciousness, right? So when you use methamphetamine, people use it to, like Adderall, was a methamphetamine. It's similar to a methamphetamine. It's a stimulant. It helps you focus. It narrows your consciousness. The problem with methamphetamine is that it narrows your consciousness. And so you're actually not that connected to the things around you or the people around you, more important, over time. Heroin narrows your consciousness in a different way. If you've ever seen somebody do a large dose of heroin, they just nod it out. So it hasn't focused it's obliterated your consciousness, and you pass out into oblivion, right? But they have the same effects. They're sort of consciousness narrowing, consciousness dimming substances. Alcohol's like that. It's a depressant. And you drink alcohol and it sort of like lowers your inhibitions and your consciousness, which is what we appreciate about it. We don't have to think so much and have all of those feelings of anxiety. So there's a group of substances over there that do that. They narrow and dim consciousness. That's why we like them. There's a group of substances in the middle. People respond differently to marijuana. And even, wine or something at smaller doses, although it dims your consciousness, maybe it connects you sometimes a little more. So there's a little bit of space there in the middle, which is why I think we sort of, have some agreement that those substances are kind of okay. And then you actually have this group of substances, largely in the plant medicine world, but also MDMA and other substances as well, that have the capacity to expand your consciousness and your empathy. And that's real. I mean, I think it's very documented that it actually kind of lets filters down and allows you to have a wider awareness and vision. And anybody who's done MDMA knows you have an incredible amount of empathy on MDMA. I mean, you're rarely seeing people fight, get in a fist fight on the street. If they're on ecstasy, like dancing together with glow sticks, it's incredible, So I think where it's going is into that kind of model where people, meaning society as a whole, is figuring out what kind of substances are good for us as a whole and in what setting, and how we deal with that legally, and what substances are really killing us and separating us. I'm kind of optimistic about that vision, but every vision of the future is problematic. And so there are huge problems with that vision, just like there are huge problems with the way we approach drugs and alcohol in the abstinence-based model now. It's more just looking at what's probable, right, as to what's good. I never know what's good in a complex phenomenon.